County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome to the program Ian Reich, who is here to talk with us from the Public Health Unit about the opioid overdose situation and what we as a community can do. Ian, thank you so much for joining me on the program today. It's always great to talk with you, but not about this topic. This is a really concerning subject, certainly, and getting more concerning as the days go by.
It absolutely is. It's something that sort of hasn't gone anywhere since COVID has been here, and COVID has definitely sort of taken the focus of the issues that are happening public health wise away from the opioid epidemic, which is understandable. We need to sort of all come together to ensure we can move COVID out of the picture as fast as possible, and that's really what our priority is as quick as we can possibly get the vaccines completed and get COVID out of the way. We can then really put all of our efforts into responding to this opioid epidemic.
Now, your role in the Public Health Unit, I'm wondering if you just mind taking a moment to talk about what you do and, how this fits within your portfolio.
Absolutely. So here at the Health Unit, my main portfolio is harm reduction and sexual health manager. During COVID, I'm definitely taking a lead in communications related to COVID-19. However, I do still lead a small but mighty team of folks that are responsible for our harm reduction program here at the Health Unit. And one of the main components of that program is to coordinate an opioid response here in Grey and Bruce. Obviously, the coordination efforts are a little bit challenged because everyone's focus is on COVID right now. However, we do still meet regularly, at least once every second month as a group. So we have police, EMS, health providers, mental health, schools, First Nations communities, all come together to really understand the current situation, what's happening, and to strategize about different ways that we can help the situation while COVID is happening, but also plan for after COVID and what that forecast will look like.
COVID has a significant impact, though, on opioid use. I know that, we think of COVID, but just like so many other things, it changes the landscape. And I'm wondering if you would speak more about, I'm looking at a media release actually right in front of me, March 19th, so not very long ago, the third fatal overdose in that particular week. I'm not sure if there's been any additional, but this is significant, but that's only in the last little while, not since the beginning of the year. My understanding is there's been 8 fatal overdoses since the beginning of the year. So what's happening? And maybe you can fill us in.
For sure. I wish there was a simple answer for what is happening. I definitely can guarantee you the fatalities are related to toxic street drugs, not simply drug use. And you did mention at the beginning there that COVID has some factor to play in all of this. And what is that? And I think that the simplest answer is throughout the entire population, throughout Canada, substance use is up. And it's not just opioids, it's substance use in general. Probably the most important one is alcohol and cannabis. Cannabis sales are through the roof. Ever since people are locked down or staying at home more often, there's more free time. But not only that, people are becoming lonely. They're developing perhaps, mental health, anxiety, depression, or the early onset symptoms of those things. And when that happens to individuals, they look for things that alleviate those symptoms. When you have a really, really bad headache, and I just want everyone to envision that. If you have a really, really bad headache, do you say, I want to take an aspirin, I want to take a Tylenol, an ibuprofen? to get rid of that headache? Of course you do. We take that medication, the headache resolves itself, and we're like, I feel better. Now imagine the worst headache you could possibly imagine, but it's not a headache in your head only, it's a headache that hurts everywhere. And if someone were to say, this drug will take care of that, will get rid of that pain that you're experiencing, I can almost guarantee you, just like the person with a headache will say, absolutely, give that to me. The problem with it is when that substance is so toxic that a single inhalation or a single injection can kill you. Another way to look at it is, imagine if we all of a sudden started seeing fatal fentanyl overdoses because your alcohol from the liquor store was tainted with fentanyl. Think of how aggressive the response would be, the recalls that would take place. It would be, something that we've never seen before in history, I believe. Unfortunately, people that are struggling with addiction, they still need their substances. And the easiest and most economical way to do that is through the street drug supply. And because the street drug supply is so toxic, and I don't want to use any other word than toxic or poisonous, because single inhalations, we have stories of people that, it's a little graphic, but are found, they have lost their life, and when they are found, they still have the drug paraphernalia in their hand or sometimes in their lips. It is that rapid, that fast, that toxic, and that fatal. And that's really the nature of those media releases, was to alert and warn not just people that typically use drugs, but also the people that may be using it recreationally for the first time or to try it out because of curiosity or something like that. We just really needed to ensure that everyone had the right information to make the best choice possible, but also to understand how, if you do choose to use drugs, and people always have and always will, if you do choose to use those dangerous substances, what you can do to stay as safe as possible. And that's really the core principle of harm reduction.
So I'm wondering if you I know it's here in the media release, but would you mind going through those strategies while we have a viewing audience because it may be that the people who are viewing may not actually be using, but they may know someone who is. And that's another way of us getting the information out to people.
Absolutely. I think number one thing is to realize that substance use does not discriminate. So just like you said, these strategies apply to absolutely anyone, because you might be family, you might be friends with someone that is in a situation. So I think the number one safety tip is don't use drugs. That's probably the easiest. Don't use street drugs, I should say. That's probably the simplest way to prevent an opioid overdose. It's not realistic. Let's be honest. People are struggling with mental health and historical trauma, and they look for an outlet in some way, and that is street drugs a lot of the time. So really, we need to accept people are going to use street drugs, and we need to provide as many strategies for those folks to stay as safe as possible.
Yeah.
Probably the best option to prevent opioid overdoses is don't use alone. Have naloxone on hand. Always have a sober person present in the event that people do overdose. They won't be in an altered state of mind, so they can give naloxone to save that life. But then call 911 in the event of an opioid overdose. Call 911, call 911, call 911. Naloxone is great to reverse an opioid overdose in a short term. 30 minutes passes, 40 minutes passes, that naloxone will stop working. If it's fentanyl or carfentanil that's in that person's system, that's going to stay a whole lot longer than 30 minutes. So that person more than likely can relapse or go back into a state of overdose. So if you don't call 911 and the person does not get help right away, the likelihood of a reoccurrence of that overdose, even after the naloxone is administered, is quite likely. Obviously, we're in a situation with COVID where we are telling people, try to stay away from others as much as possible. We have to balance that risk with the benefits. Obviously, staying alone if you're using street opioids, it's not a good idea, and it's highly recommended that you actually break the COVID rules and be with someone else to support you through that experience. But we understand a lot of times people with significant mental health conditions, PTSD, or anything like that, being with someone else is the last thing that they want to do. They are shut in a lot of times. They are scared to go out to the real world. In that situation, there is an overdose prevention line that people can call where someone can be on the line with them while they use.
Wow.
And what it
Yeah.
does is basically if that person becomes unresponsive, doesn't answer the operator anymore, they can call 911 on that person's behalf. So it's a really quite a good seamless system for anyone that has access to a telephone while they are using, if they are alone. Those are really, just like we have our 3 W's for COVID, we have these very simple techniques for harm reduction is don't use alone, have naloxone on hand, don't be afraid to call 911. And if you do need to be alone, call the overdose prevention line.
What you're really describing is for people who are using, or those who know of people, to come out of the shadows. Like, just because sometimes people will use alone, but you're saying, come out of the shadows, let us support you. Yes, we, as a community, hearing of people dying of overdoses, that as a community, that's not healthy for anyone, whether it's the first responders who have to attend the scene of someone who's died, family members who experience that significant loss, and people like yourself who work so hard to try and support those, the program and the people who need the support. I mean, there is a huge ripple effect. It's not just the one person who takes a fatal overdose. Huge ripple effect. So certainly I think, your message is well taken. But the quality of the street drug supply, has COVID had an impact on the toxicity because the supply has changed?
Well, we started receiving word in early 2019, actually, that carfentanil was increasing in the street drug supply. And what carfentanil is, it's scary. Carfentanil is basically 100 times stronger than fentanyl. And fentanyl itself is 50 to 100 times stronger than codeine. So carfentanil, basically, it was developed as an elephant or an extremely large animal tranquilizer. The thing is, it also can extend if you were to use carfentanil to enhance, let's say, an existing opioid supply, I'll use heroin as an example. Just a simple grain of carfentanil added to, let's say, a typical size street supply of heroin that you get on the street, you're multiplying the strength of that by a tremendous amount. So you're making a supply of X grow exponentially. So that's why carfentanil is so popularly used, and we've started to see an increase regularly in the amount of drugs that do have carfentanil present in it. So I can't say that COVID specifically has made street drugs more dangerous. However, it is a very regular trend that as time progresses, we are definitely seeing the street drug supply become more and more toxic. And not just toxic with carfentanil or fentanyl, it's also starting to include a whole slew of other substances with it. Probably the most common is what we call benzodiazepines. So your Ativans, for instance, are now being mixed into a lot of these drugs, but it's not the prescription grade type Ativan that you'll be able to get. These are another substances that the chemical product that's included is another 10 times stronger than a typical benzodiazepine. So we're starting to see people, they come back from their opioid overdose after naloxone is administered, but now there's this other substance that is actually prolonging the overdose and is confusing first responders and our medical professionals a lot of the times because they stay unresponsive and their symptoms aren't typical to what you would see in an opioid-only overdose. So it's definitely a very complex issue with the street drug supply. And it's not just containing one thing or another, it's now containing multiple amounts of different products.
So that increases the risk when the medical professionals who are trying to revive an individual, whether it's right there at the scene or transported to a hospital, if they don't know the substance, it's rather challenging then, I would think, to be able to reverse the effects.
It is extremely challenging. One overdose alert that we did send out back in January was a result of the ER calling us saying, we've had 3 people come in with these types of symptoms, and we don't really know what it is. And basically going back and forth with them, we were able to get enough details to be able to alert folks that more than likely the street drug supply is containing this dangerous benzodiazepine along with the fentanyl products. So that network that we do have, and that's again the work at the opioid working group level, we develop these channels and networks so that we can really quickly send out alerts in near real time. Usually we'll get alerted in the morning, and by the afternoon we have an alert that will go out, that sort of thing.
So it's very, very quick to get that information out. So someone who, when you describe the drugs, for someone who may encounter an overdose individual, someone who's overdosed, is there a concern with them touching the person or touching, you mentioned they have drug paraphernalia that may not even have slipped out of their hands? What would your advice be, and how do people obtain the naloxone kits?
Definitely. So I think step 1 is come and get educated on how to administer naloxone. So we provide that service Monday to Friday, 8:30 to 4, directly here at the health unit. Just stop by and say, you know what, I'm either personally at risk of an overdose, or I know someone that's at risk of overdose. If you meet that criteria, we'll do a full training, and we'll stay with you as long as you need to make sure you get the training properly. But in terms of, being concerned about helping someone through an overdose, let's say you find someone on the streets. If you have naloxone on you, that's wonderful. Step 1, call 911. Always, that should be your number 1 first step. Call 911. If you're trained in first aid or have had training in how to administer naloxone, you want to observe the site. So you want to have a lookout for any dangers. No wire, no fire, no glass, no those sorts of things.
Yeah.
We just want to make sure that the scene is safe. There's no danger in touching someone that might be overdosing.
Okay.
Fentanyl or carfentanil, let's say there's minor amounts on the ground. If your bare hand touches fentanyl, it's not going to absorb instantly or anything like that. It's a powder form. It needs more liquid to actually absorb through the skin. And even then, it's still fairly a slow absorption. Mm-hmm. The number 1 thing is don't use alcohol hand sanitizer if you do have or seen any powder on the scenes. The alcohol will actually draw it in a lot faster. Okay. There's never been a first responder die of a fatal overdose related to accidental exposure. So that's another good thing to realize. Yeah. We do, in our naloxone kits, include gloves. We also include face covering if you are going to decide to give artificial respirations.
Yeah.
During COVID, it's totally okay to simply administer the naloxone. And if the person is not breathing, you can administer chest compressions, because they will actually pull in a little bit of oxygen every time you push down on that person's chest. We'll pull in oxygen and allow that person to expel that oxygen as well. Ideally, though, the person will respond virtually instantly with the first dose of naloxone, and they'll start breathing by themselves. If they don't, after about 5 minutes or a couple minutes, you can administer another dose of naloxone. And if you have more kits available to you, you can keep administering it every couple minutes. You're not going to hurt someone by giving them too much naloxone. And if a person has had a heart attack and they're not even struggling from an opioid overdose, you can still administer all the naloxone you want. You will not hurt that person. The drug will really all it will do is help the person through an opioid overdose.
Yeah. And that's really helpful information. The most important thing before you try anything, call 911, because then you have backup, you have others join you. Don't walk away.
Correct.
Just stay and help, because the Good Samaritan Act protects people, correct, who try to help. Yeah. Yeah.
Absolutely. The Good Samaritan Act is actually a really interesting piece when it comes to overdoses and responding to overdoses. If there's a group of individuals using together and one of them does suffer an overdose, that group of individuals, regardless of what drugs they have on them, as long as it's not a manufacturing factory or something like that, but if they do have small amounts of drugs on them, they can rest assured that if they call 911, police will not come to arrest them. Police are strictly there to help the individual that is overdosing. And to ensure that the EMS have a safe access to the scene so that they can help and bring that person to the hospital. The police, through the Good Samaritan Act, are not able to arrest anyone for simple possession when they are responding to an emergency call. That is critical importance. We did see a trend earlier in 2020 where 911 calls were way, way down. And through just talking with folks, they were afraid that they were going to be arrested. And I know through multiple conversations with their local police forces, they are 100% behind the Good Samaritan Act and they're there to save lives. They're not there to arrest people for small type possessions. That's really not the issue. So
and
absolutely.
That's important. Yeah, that's important for anyone who's hesitant or people who, life comes first, and that's the priority.
Absolutely.
For sure. You mentioned earlier about substance use is going up. So we've talked about deaths, but there are many episodes where we may get first responders called out. The person does not die, but are those numbers tracked anywhere? Are we able to track those as well?
So when EMS in Grey and Bruce County respond to an opioid overdose, they do actually, once they're finished the call and they start their charting in their computer system, that will trigger an automatic notification to us here at Public Health. And that lets us know how many calls they've responded to suspected opioid overdose. I don't have the number directly in front of me, but I do know January and February numbers were, I don't want to say staggering, but they were definitely up compared to 2019, or 2020, sorry, which is definitely understood given the rate of fatality is probably the highest it has been to date as well. We also do get reports from the province, and where that number comes from is anyone that goes to the emergency room for an opioid overdose or a suspected opioid overdose. So we get those numbers as well on a monthly basis from the ministry. That is also available on the Public Health Ontario's Opioid Tracking tool. It highlights all overdoses that are confirmed, along with fatalities that are confirmed specific to a region, a province, that sort of thing. So we do get numbers from all over the place, and we're just now starting to work on a mechanism to work with some police forces to have them also send the data of when they respond to calls too.
Excellent.
Is really to get a good, clear picture of what's happening. We can't just look at data from one place. What we need to do is collect it from as many reputable places as possible and put it all together to truly tell an accurate story of what's happening in near real time on the streets.
So the question that more and more people are asking, why do we not have a safe distribution supply and safe use areas for people, recognizing that addiction is a health crisis and not any other. It is definitely related to mental health, physical health, and a pain response strategy. Can you answer? I mean, I know there's many different perspectives about addictions, but if we think of it with a health lens, and we know that there is a toxic supply out there, what can we do about keeping people safe while they are making choices about how they proceed?
Absolutely. There's many strategies that can be done in short term, but I also do think we really need to focus on the long-term strategies to help the situation from the root cause. So in terms of the short-term strategies, in September, the Board of Health endorsed a letter from the Municipal Drug Strategy of Ontario. And what that letter was basically saying, we support a safe supply initiative to be operational here in Grey Bruce. And what safe supply means is that physicians would be able to prescribe high doses of opioids that are basically replacing the toxic street drug supply for individuals. There's a huge amount of complexities to that. And because of that, we've actually assembled what we call a feasibility and readiness assessment group. And we will be working through that as COVID ends. We will be prioritizing that work locally here in Grey Bruce. We do need COVID to sort of go away per se, to be able to focus the amount of resources that are needed to bring to bring the community together, because we do want to ask the population in general, we want to ask health partners, we want to ask municipal and county leaders about their input on how they feel about this, but also educate them on what safe supply actually is. So in terms of short term, that's really the priority. But I do think long term, we need to look at solutions, how we can resolve the root cause. And that root cause really is mental health and trauma. We need to figure out how we can identify mental health and trauma at an early age and how we can resolve it prior to it becoming an issue later on in life.
Yeah. It sounds like as we move through COVID, and we talk about the recovery stage for COVID. Right now, it just, we're just waiting. But it sounds like the work around addictions and substance use will be absolutely significantly important as we move through COVID, because, as you say, the use is up, and certainly the concerns around this are there. What do you say, and I know we've chatted before, but what do you say to people, or how can we assist in sort of an attitude shift from blaming to supporting? What would you say to the public when they say, why would we do this? Why would we think about these initiatives when it should just stop?
It's wonderful. The one thing I like to compare to, and it's not a comparison directly, but people that smoke and they develop lung cancer. I guess I can ask the exact same question, but frame it using that. Why should we as taxpayers have to pay for cancer therapy for someone that smokes? Well, the answer is simple. We care for every life in the healthcare system. We don't just care for certain segments of the population. I didn't become a nurse because I only want to provide nursing to A, B, and C, but not D. Mm-hmm. We care for absolutely everyone. So the general public has all the right in the world to not agree with something. But I urge people, even if you don't agree, research and learn, have conversations and talk about it openly with an open mind. Talk to me, talk to any of my staff, talk to anyone in a mental health agency about the issue and get the true facts. Don't just go by preconceived notions of what you think or what you feel. Educate yourself on the facts before you decide to make that final decision or that final conclusion about safe supply or a safe consumption site or something like that. Really understand what it is and why it's being done. I think with that, we can decrease the stigma and really fight through those barriers.
Ian, as always, it's a pleasure to speak to you, and your message is so critical and definitely on point. This is an important health issue. We need to care for everyone. And please, if there's anything we can do to assist you here at Rogers TV, you are welcome to come on our show at any time. Thank you for all that you do.
Thank you so much.
Thank you to our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Please take care and stay safe. Thank you.
The Rogers TV viewer response line. Email us or connect with us on social media.
Hi, I'm David Shearman, host of Politically Speaking. Join me for my next show, where I will have as my guest Grey County Warden Buck Hicks. Politically Speaking on Rogers TV.
It's closing time, and you stayed out longer than you planned. So now you can't drive, and the buses have stopped running. You could always call your girlfriend. Or maybe you